Thank you for coming, you guys. This is the first time I've attempted to do this talk. It's not as polished as I would hope it to be. When I give a talk, I want to have it all here. And I'm having to use my friend Stacy Sims' slide deck to trigger my points so that I don't forget anything because there's so much in here. So this is a talk for the women in my life and all of the women in your husband and significant other lives. This is a big deal. Why is it a big deal? Because women are underrepresented in the field of sports and research and studies. Most medical studies, let's just face it, it's been a men's world, and so much of the cardiovascular stuff and including athleticism has been dominated by men. So it's about time that ends. We need to balance the playing field, right, ladies? This is a butt kicking, ass kicking, let's just call it what it is, lecture that's really day one. This is your new day one of life, birthday, on looking at how do I have the physique, the glucose, the lean muscle and bone mass that I want for as long as I want. There's a lot of you walking around right now that are actually pretty fit, but are dealing with things like belly fat, dealing with things like glucose and insulins that don't make sense for your body type, or bone loss, or losing muscle prematurely, and you're athletic. You've donated a lot of time and resources towards doing the right thing. I will preface this talk by saying I am on a journey with you as a guy from the guy's side of it, learning for the first time a lot of this information, and it's caused me to rethink and to change a lot of my recommendation. We're going to debunk a little bit of the myth of fasting, intermittent fasting for women as a good thing. I'm not necessarily a fan. And those of you who've been with me for a while, I was talking intermittent fasting 6 months, 8 months ago. I think for men, there's a time and a place. For the women, I'm having a harder time finding a time or a place to do intermittent fasting as a good thing. Now, that's different from time-restricted eating, which we're going to talk about the difference a little bit today. So we're going to talk about some of the changes that have transpired. I always say run if you've got a provider who's telling you the same thing 5 years, in time that he was talking to you about, and there's been no new data. That means they're not keeping up. Medicine changes so fast, as you can imagine, that if you're not changing your opinions on things, you're probably not keeping up with the current data. And so I'm here doing penance for all those women I told to do intermittent fasting over the last 10 years, who didn't find it very helpful. Now, some have. And I met with a patient today who said, it worked for me. I did alternate day fasting and I lost 40, 50 pounds, and I've been able to keep it off. So there are those exceptions. But then there's the bulk of you who often come and say to me, my husband did it, kind of a half-assed attempt, and he lost all this weight. Immediately, I hate him. And I didn't lose anything. And there's a reason for that. And I didn't know that a year ago. There's some new data on what's going on. And come to find out, it's not because you've got too little testosterone, and men have all this testosterone. Estrogen does some pretty amazing things for you all. And the way that estrogen and testosterone work in the female versus the male body is really very, very differently on a lot of levels. So come to find out, women are not just little men. You guys have completely different physiology, and we need to stop treating you like you're just smaller versions of us or different in some way that is not scientific. So this is about ending and busting myths, empowering women to take control, encourage them to get involved, whether it's being a practitioner, a researcher, an athletic trainer, spread the good news to your friends. That's why I'm here tonight. So I got excited about this lecture. I'm going to give credit to Stacey Mills, PhD. She's a rock star researcher. She lives in New Zealand. She's, I believe, also dual citizenship here. She does some stuff at Stanford. There's a few people that I will drop names regarding giving credit to some of this information that's being disseminated. Andrew Huberman, the Huberman Lab, is a strong voice Gabrielle Lyon, her new book, Forever Strong, that's Lyon. She's a practitioner that I met and got the privilege of hearing speak in Las Vegas, along with Stacy Sims in Vegas about 2 months ago. So these two ladies got standing ovations. There was 1,500 practitioners in the audience, and that was quite a sight at the Bellagio to see a room that's that huge, full of people like me, giving these two women, and they're up there all tatted out with their sleeveless tops and just ripped, and I'm like, way to go. And these are 50-year-old people, which look amazing and they feel amazing. Stacy Sims is a PhD. She's not a practitioner, so she doesn't write for hormones. So she's not necessarily bashing using hormone replacement therapy, which you all know, full transparency, I'm all about that. But this is kind of in addition to, what do you do? It's not just hormones. There's other things you can do. One of the takeaway messages tonight will be that as we move from our premenopausal age to peri and postmenopause, estrogen and testosterone and growth hormone, which are there to maintain glucose and insulin sensitivity and muscle mass and bone mass, over time, these things, as those hormones drop, have to be replaced with other things. And if we're not doing bioidentical hormone replacement, we want to make sure that we're using things that the body understands, that are triggers to say to the muscle and to the bone, hey, I'm not done with you yet just because I'm done having babies. I'm 50, 55 years of age. I've got a whole life ahead of me. And I don't want osteopenia. I don't want osteoporosis. I don't want to have to be taking peptides to lose weight necessarily. Or if I don't want to do hormones. Now, I think that there's a whole nother discussion to be had where we can have additive effects. So this is not in place of hormone therapy. It's in addition to. There are folks that for whatever reason can't do or don't want to do hormones. And this is a talk for you. So I'm going to try to read these the best I can without putting anybody to sleep. Basically, I talked about the fact that you guys are underrepresented in the world of sports and research. There's been sexism and stereotypical. I mean, how many of us go, to the gym and hear, oh, do a real push-up, not a girl's push-up. I mean, that's lame. That's disempowering. It makes you guys feel like you're something less than the awesome chicks you are. So I hate language like that. And I hear women saying that from up front that are leading the class all the time. So the implications are that, there's this kind of generalized misconception that women shouldn't be in sport. They don't belong in the gym. There's this kind of prejudice. And I think it's time that goes away. And that's what they're referring to here. There's this kind of masculine language that's used, which we referred to with regards to sport. This is a picture, I forget this gal's name, but this is a famous marathon, and it wasn't that long ago. And these are the officials escorting this young lady who wanted to join the race and who kind of joined it illegally because it was for men only. And she's being escorted and forced out of sport and competition. And I just can't believe there was ever a time where something like that occurred. It's just ridiculous. These are things that happened within my parents' lifetime. So it's not just about hormones. You guys have different chromosomes. And come to find out, the X chromosome, you've got a couple of those. Us guys have one. They do some things. It's not just about sex hormones that makes you all different. There's kind of this independent contribution that occurs, and I want to go through that. The more X chromosome dosage they refer to that you have, and if you have more X chromosomes, which you all do, there's this increased tendency to lay down fat tissue, have more insulin resistance. And there's some appetite things that go with that as well. We think probably from an evolutionary perspective, it's not lined up, it's driving my OCD nature crazy. There's probably evolutionary advantages for you guys being able to store fat more efficiently because you're the ones carrying the species, having the kids. And so there's some adaptations chromosomally, which makes sense. Some of the things I didn't know, that you guys are set up to be way more efficient. I kind of knew that. but I didn't know the specifics on this metabolism stuff. You guys are able to conserve fat and glucose and glycogen over guys with the same level of intensity of exercise. In other words, you're built to go longer. You're built to go the distance. Guys have a little bit of advantage on the short stuff, the sprint, the power, the explosive part. But you guys are set up to be kind of aerobic machines where you just burn super efficiently. And that's at the mitochondrial level. So you're already chromosomally set up to do that. It's not necessarily to your biggest time advantage to spend a lot of time developing more of that with ongoing stair-stepping, treadmills, and cardio. There's nothing wrong with cardio, especially when you're premenopausal and you still got all that great hormone driving muscle mass and things like that hormonally. You can pretty much get away with anything till you're about 30, right? All of us. And then when you start hitting 40s, 45 menopause, you have these more tectonic movements that are occurring with hormones. And so we have to engage heavy lifting and protein to take over those signals that the hormones used to do for us. You could go home. That's really what I'm going to talk about after that. That's really kind of the crux of it. Just know that there's some things besides hormones that are built into your chromosomes that have to do with how efficient you guys are. They talk about the second bullet point of metabolic flexibility. Over men, you guys have the ability to flex fuel, where your mitochondria can use fat or can use carbs more easily. Whereas the guys are set up to be more anabolic, more glycolic, where they're using more anaerobic metabolism. So we're set up for that, again, that short, intense energy that's needed. So you guys are more metabolically flexible. Metabolic flexibility is lost with obesity as we put tummy fat on and as we get more pre-diabetic. That's why we call it metabolic dysfunction. We lose that flexibility to use different fuel types. And it's advantage. You know, we hear about ketones. We hear about, you know, avoiding carbohydrates so that we make more ketones. There's more to the ketone diet. And if we get time, we're going to talk about why I'm not a big fan of that, especially not in women when you look at the new data. You guys have greater estrogen receptor alpha expression of that protein receptor. And that's a big deal because that's on your skeletal muscle. And what you all are using your estrogen for, it's not just for babies and for not having hot flashes or having good skeletal muscle mass. That estrogen is what's creating your, not only your quality, but your quantity of your skeletal muscle mass, your lean mass. You hear people talk about fat-free mass. That's a lot of that is skeletal muscle. And estrogen has a huge role there. Everyone's focused on testosterone right now. I've got low libido, get testo. Okay, well, estrogen drives female libido, probably number one. Testo's a partner in that, but it's estrogen that's really governing your glucose, your insulin sensitivity, your maintenance of your muscle mass. So guess what happens when all that goes away at 50? Okay, I promise I won't talk about hormones tonight. All right, so we're going to talk about hormones a little bit. You guys know, sorry, I just can't help myself. This is actually in the slide deck I'm using, so I was forced to talk about these. Estrogen, progesterone, you guys know a little bit about this if you've followed me at all. There's 3 types of estrogens, estradiol being the most powerful. This is the one that's occurring until you hit menopause, and then largely what you're getting is estrone here made by the adrenal gland. Assuming you have an intact functioning adrenal gland, a lot of people have been pretty stressed out. They have adrenal dysfunction, hypofunction, and there's not a whole lot left in the tank. So when the ovaries go on permanent strike at age 50 on average, it can be a real problem, real crisis that way. So there's 3 types. One of them is very, very weak, estriol. You know, we don't use that other than maybe vaginally for topical applications. Estradiol is the one we use for replacement when we're doing things like that, and estrone is involved with an inequilibrium with estradiol. This one's the most carcinogenic. This is the one that's found in things like Premarin, you know, in very high percentages. which is why we don't use pregnant mare urine in this clinic. Sources for hormones. Progesterone, it's anti-estrogenic in effect, it's kind of the balancer. What's interesting, as you're going to see a little later, is that estrogen is very anabolic. It's building muscle, it's building bone. Progesterone is considered more catabolic, breaking down. Now, it does help maintain things like bone mass just as well as testosterone and things like DHEA. Those are all very supportive and anabolic when it comes to bone. But progesterone actually inhibits muscle protein synthesis in your skeletal muscle. So it's estrogen that's the bad boy as far as stimulating muscle mass in women. Follicular stimulating hormone, FSH, you guys have seen that potentially. It's what your brain is making from your pituitary, and it's what tells your ovaries to make a follicle so you can spit out an egg mid-cycle and have the potential to get that thing fertilized and have a child. Luteinizing hormone is involved with ovulation and making estradiol as well as FSH. They have little different roles, but that kind of the complicated slide that shows you what's happening. This is basically the first 2 weeks. This is ovulation. You get the LH spike. You get the big estrogen. FSH is what makes that happen. Follicles developing. It pops out, makes an egg. You get the luteal phase, the last 2 weeks. That's higher in progesterone and lower relatively in estrogen. Exactly flip-flop from the first 2 weeks. So when we talk about exercise in women, and you guys are doing this kind of gymnastic thing, 2 weeks on, 2 weeks off, where there's a flip, the estrogen and the progesterone levels matter because they determine how you're going to do metabolism. How many carbohydrates do you need? How much protein do you need? Well, guess what? It changes depending on where you are in the phase of your cycle. This is why we don't want women fasting in the last 2 weeks of their cycle, because their estrogen's lower, their progesterone's catabolic, breaking things down. It's inhibiting muscle synthesis. Your protein requirement goes up the last half of your period by about 15 to 20%. So if we're telling you to do intermittent fasting and skip breakfast and don't eat anything but 2 meals a day and start at noon, and you're already 20% down on your protein requirement, yeah, it's a big problem. So we start losing lean muscle mass, and we start getting less metabolically flexible. You might weigh less and think you've been succeeding because you've lost all that muscle. And that's exactly what we don't want to have happen. Add a shot of semaglutide or Ozempic or something like that once a week and take your appetite away. And now you're not getting enough protein for sure, but you're losing weight. So that's good, right? You're on a shot. You're paying a bunch of money to get a shot to lose weight. Now you're losing a bunch of more lean muscle mass. So you can see where you've really got to be careful. We use GLP-1 agonists, which is the medical term for things like tirzepatide, Mounjaro, Rybelsus, Wegovy, semaglutide, Ozempic, all these things that all your neighbors are shooting into their tummy once a week, whether they tell you or not, they are. If you see them get really small, really quick, they're on it. The thing is, it works really, really well. You just have to make sure that you compensate and get more protein in and that you do the right type of exercise so you're not losing all this lean muscle. The point of this slide is not to have the deer in the headlight with all you guys. It's to let you know you are special. You're equipped for a sacred task. You've been given this task. We never got the chance to have kids. It's all on you guys. And because of that, you've got this amazing gymnastics that's occurring. And it depends on where you are in your cycle as to how we treat you. You're a different person here than you were here, hormonally. And so we can't say, do this all month long. That's old thinking now. And we especially can't treat you like guys. That's what it looks like when you're taking an oral contraceptive and it's just, every day, progesterone, estrogen, a defined dose. And then you stop, there's the sugar pill for a week. You bleed, and then it starts all over. So very, very different appearing. We're going to skip through these because they're a little bit more. Menopause, this is kind of cool. This is talking about testosterone. We got to talk a little bit about this. So at puberty, there's this big spike. You go through puberty. It kind of peaks and it slowly declines over your lifetime. Unlike progesterone and estrogen, you guys, like guys, have a very slow decline in T. It's not this abrupt clip like you have with those other two. Growth hormone kind of masquerades this as testo. You get kind of a reduction, usually about 10% over each decade after age 30, 35 years of age. It accelerates over age 50. It starts dropping by about 15% per decade. So growth hormone is a big deal because it maintains leanness and protects protein, structural mass, your lean mass, and it really kind of helps burn fat. So it's not a good thing that that's going away as well as your testosterone. Testosterone's helpful for all these things. It plays a role in women's estrogen production. That's where estrogen comes from, is testo. There's this age kind of normal considered decline. It contributes to libido. It's not the only thing. Estrogen's probably number one in my experience. It does help with maintenance of bone. I would say it does help with that. And I would also suggest that you remember nothing else. Remember this bullet point right here. Free testosterone, that's referring to your lab, is not associated with muscle strength. I have a lot of female CrossFitters who would look at that and go, what the are you saying? Now, that doesn't mean that testosterone's not helpful, but your free T levels are not in the medical literature associated with how strong your muscles are. The production is from the adrenal as well as the ovary. Even after you go through menopause, the ovary continues to make testosterone, even though it's really making very little to no estrogen or progesterone. The little bit of estrogen you have in your body is mostly coming from what I said earlier, which is the adrenal in the form of estrone. And progesterone, just a little tiny bit, again, from there. Testosterone is largely coming from that post-menopausal ovary. So there's a reason to have those guys around if you can, outside of just the estrogen that you had earlier. And yeah, there's this big change that occurs with testosterone relative to the rest of your life when you go through menopause. You'll see a drop down in stress. We call cortisol the kryptonite to testosterone in men. Well, it is for you guys too. When you got a lot of stress, guess what? Your testosterone is not going to work very well. So if you're not sleeping, these are deal breakers for women's health and guys too. If you're not sleeping well, at least 7 hours minimum of quality sleep a night, and you're not addressing high cortisol, your stress, everything we're talking about is for naught. Those have to be in check. The things you have control over, you've got to deal with them. Your schedule, the chaos, those things that you have no control over, you got to say that prayer and realize, I don't have control over this. I'm going to do what I can, and it's good enough. Or get yourself out of a situation, if you've got a bad thing going on, change it, reframe it. Don't just stay there, because cortisol is a big problem. This is what estrogen does. This is amazing. And we're going to show a little bit later here. Keep in mind that this same list looks an awful lot like heavy weightlifting and protein. So for those that aren't into estrogen, we can get similar benefits postmenopausally by lifting, as Stacy Sims says, pardon my French, girls lifting heavy shit. This is her t-shirt and it's on there, so I have to say it. But yeah, I just loved it. I think she wore it on stage during the second lecture she gave. But estrogen is about structural muscle, glucose, managing your blood sugar, making sure you've got plenty of quality and quantity of muscle, reducing oxidative stress in the mitochondria so that it's working more efficiently. It works not only in the muscle, but it works in the brain. We talk about these shots that people get to reduce weight. One of the ways that they work is they reduce the noise, the food cravings, and that has to do with serotonin in the brain. Well, estrogen does that same thing. Estrogen is one of the chemicals in the body that inhibits or suppresses appetite. So a lot of people say, oh, you're going to put me on estrogen? I don't want to gain weight. Well, birth control pills where you've got a whole lot higher dose of synthetic estrogens, that's a different deal. And you're going to see some increased weight with those folks. But when we're talking about using bioidentical postmenopausal replacement, that really shouldn't be the case because we should be helping to suppress excess appetite, just like the peptides do. And it does this through serotonin. That's the same mechanism, neuropeptide program that things like tirzepatide and semaglutide are working through. So I love it. They take the shot out and they say, oh no, my food noise came back. I say, great, we can lift weights, do protein, and make sure your estrogen's optimized. There's hope. We don't have to be on that shot every week for the rest of your life. Of course, it helps bones. You know, it's used for the treatment of osteopenia and to help prevent that as well as osteoporosis. It regulates inflammatory chemicals. Estrogen is what makes you absorb more calcium from your food and inhibits losing more of it through your urine, through your kidney. And it's got all these wonderful metabolic effects. So if you're pre-diabetic, one of us in this back are saying, oh, I don't know why your insulins won't come down. Your fasting insulins are still high, which is an early warning sign that you might be getting metabolic inflexibility. You're developing metabolic dysfunction, pre-diabetes. Well, it could be that there's something going on with your hormones, not just looking at things like your food, your diet. Okay, so progesterone's interesting. We're going to see where it inhibits protein synthesis in the muscle. It is neuroprotective in the brain. We use this for traumatic brain injury, people that have a lot of neuroinflammation. COVID patients, you know, often they have a lot of that with the loss of smell, taste. They're getting anxious, depressed, and insomnia, all signs of intracerebral inflammation. It helps with bone, okay? So even though it kind of does a little bit of a number on the muscle, it's redeeming itself here in the bone. It helps to reduce bone loss along with testosterone and estrogen. And it's got some metabolic effects too, albeit them a little less important. So that's chromosomes, that's hormones. Let's talk about why y'all came. Let's talk about this. Now, this is crazy. This is a gal down here in the bottom, and it's basically just showing how you're preserving and you're getting more quality of muscle. Estrogen, this is a muscle cell in here. This is the membrane of the muscle cell. And basically it's showing estrogen coming and docking on its receptors inside the cell. It docks on the muscle cell. It docks on the mitochondria. It goes to the nucleus and it makes things. It makes proteins. It makes myosin, which is the little contractile filament that makes your muscles contract and squeeze. So it's doing that. It's making the mitochondria work better, and it's actually producing quality muscle mass and muscle itself. So you're preserving the mass as well as the quality. And this is a signal that will do the same thing. So when your estrogen goes away, when you're doing the right kind of resistance training, you can stimulate or signal the body to do these similar kinds of things. And that's, again, huge take home. So the benefits of strength training, we talked about how you guys are kind of set up from a cardiovascular efficiency state when you came into this world, just with your chromosomes and the fact that you have a certain amount of hormones in the right ratios. You kind of stack the deck for success on aerobics. So we want to build your anabolic, your anaerobic metabolism. Why? Because we want to do things like keep your bones around. We want to really watch your glucose metabolism so you're not developing prediabetes, joint stability, and brain health. We don't want you all getting dementia. You all have more Alzheimer's than we do as guys. We don't really know why yet, but it's important. And strength training is known to help the brain. It makes this stuff called BDNF, brain-derived neurotrophic factor, which is kind of like Miracle Grow for the brain. And it makes these little neuroplastic connections more efficient, and there's more of them. So resistance training is also beneficial neuromuscularly, which means the speed of a muscle contracting and how strong it contracts is helped by resistance. more so than cardio. Cardiovascular medicine, vasodilation, relaxation of the blood vessel, lowering blood pressure, improved with resistance training. Body composition, that means more lean muscle and less fat. That's both visceral, that kind of stuff that's inside that you can't see, as well as subcutaneous, so total body fat. Muscle strength, yeah, that's kind of obvious, as well as endurance. So this is just talking about, I'm going to do this one slide and we'll kind of burn through these. Know that as females develop, they go through puberty, there's this change that's occurring in their body. There's a decline in their athletic ability. And it's funny because you'll see these girls at 9 and, doing everything that their 9-year-old boy friends in the neighborhood can do. And then all of a sudden, they're not out there kicking the 9-year-old butts, or the boys in soccer anymore. They're on the bleachers texting with their 13-year-old and 12-year-old friends. And so there's a little bit of a change in their athletic ability just because they don't exercise as much or they lose interest. But there's this temporary lack of coordination that occurs. You guys have some more knee instability. There's a decline that's predictable with widening of the pelvis as they go through hormonal exposure and go through puberty. So you get a little bit of a decline in some of these performance objectives. It's temporary. It comes back in late puberty where y'all can get catch back up that way. And then you've already outgrown us all. We'll catch up later as far as stature. But you guys as women go through this kind of lack of coordinated location. And that's really where we want to focus on right form drills, making sure that you're not having those young girls go out and lift a bunch of heavy weights. No, that's not the time to do that. They're so prone to injury. You want to make sure that they've got that form down first to prevent injury. And later on, you can get a little bit more aggressive. And this is just talking about some of the greater overuse injuries that we know in the literature occurs, especially in the back and the lower extremities. ACL, more common in this age group, often in girls. And you'll see some changes in bone because of the hormones again that are occurring. So know that puberty is kind of a sacred time as far as y'all are transitioning. And we have to know that it's not until these later stages of puberty where you can progress to resistance. Technique and working on efficiency of how you move and form is where we should be really in early stages of puberty with girls, especially because you guys have unique needs and things happening. So premenopausally, there's all these questions. I've got these periods that are happening to me, and how many reps, sets? Do I work on hypertrophy? Do I work on power and strength? Do I exercise so many reps to failure where I can really do the last two? What's the most efficient way to go? And the answer is, it depends on if you're on birth control or not, because you're going to be taking progesterone and estrogen, which affect a lot of those answers. It's not an easy yes or no. So it's a very personalized decision. Peri and postmenopausal, perimenopause is that period of time where your body is starting to have longer and shorter periods. They're becoming less regular. Your brain is starting to say, I'm done with kids. I don't need to keep ovulating and popping out these eggs. These are kind of the three things in a peri and a postmenopausal female that we want to focus on. Heavy resistance training, high intensity interval training, which is the cardio. And they break that into HIIT, high intensity interval training, and a new term I'd never heard called SIT, which is basically sprint intensity training. And that's more akin to what some of you might know as a Tabata drill, where you're going all out, 100% max effort, everything you got for 15 seconds or so, 30 seconds tops. And you might then recover for a minute to however long it takes. In track in college, it used to be, sprinting the straights and walking the corners. It's kind of akin to that, where you're doing that over and over. Well, you can't do them anymore. Some people do that 5 or 6 times. Some people do that 8 or 10 times. The idea is to do hit and sit though less frequently. A couple times a week usually is all that you're doing. And we're going to talk about why that form of cardio is so much more beneficial to you than holding on to the treadmill and blogging away for 45 minutes, or the stair climber, or even the ellipse. This is where a lot of the folks that are in exercise physiology, they're saying things like, hey, those circuit training classes that are making you sweat and kicking your butt every day, great, but as a female, they're probably not the best use of your time. You should be lifting heavy weights. You should be doing high intensity cardio and doing plyometrics. Now, plyometric, how many of you have heard that term before? Okay, a few in the back. I'd heard it before, but I never really understood what it means. It's basically the idea of moving your body in multiple axes, planes of movement. So it's box jumps, where you've got a box and you're sitting here and they'll show you how to jump up onto it and then jump back down. It's skip jumping, where you're skipping like you did when you were a little kid, but you're doing a little hop there in the middle. It's doing push-ups, where you go down and you come up and you do a clap in between and then you go. So there's multiple areas of, it's lunges. Lunges is a type of plyometric. It's any time where you're moving in an axis, and it often involves multiple joints. But this is an area, especially peri and postmenopausal, that you want to keep up, because it has specific advantages in addition to doing the cardio, high intensity cardio, and the heavy weightlifting. So these are the three things that we're going to focus a little bit on. All right. So this is basically looking at premenopausal, the kinds of things that you guys should all be doing. Cardio, not a big problem. Keep going. I mean, do it. A little bit of weightlifting, working on form, lifting kettlebells the right way, doing things like squats, and deadlifts, whether they're Romanian or more traditional deadlifts. You got to know where to put your feet relative to that bar. You got to know where your butt and your hips are relative to your shoulders, so you don't blow a disc. And a lot of people, they see this part of the lecture and they go, oh, I'm not a gym person. I don't want to be that person. And a lot of you are already saying that to yourself, and I get it. Even if you have a home gym, I beg, I plead with you, sign up for a month or two with a trainer, have somebody show you how to do deadlifts and squats. And you can do it on the Sims machine, where it's got the rails, so you're, doing those safely. And several of those multiple joint types of heavy weightlifting forms, so that you don't injure yourself. Because once you hurt your shoulder, a knee, or your back, especially when you're over 45, 50, you can spend the next 6 months or longer trying to nurse that thing back, that injury. So premenopausally, you can get away with a lot more. You've got a lot of estrogen around. It's stimulating all that good estrogen, skeletal muscle, bone. You're losing a little bit of that. You're losing a little bit of growth hormone, which is involved along with testosterone at regenerating tissue as you get older. So we're more vulnerable over 50, both men and women, but you guys take a big hit there. And so this is more of a plug to make sure that you get trained. And even if you don't want to be in a gym, at least go learn how to do those things right. And then if you want to buy kettlebells and get some of these basic equipment to have in a home gym, great. I personally liked having a gym membership when I lived here, because I got to know people. So it becomes a sense of community. There's a camaraderie. There's an accountability factor when you don't show your butt up for a few weeks. It's like, where you been? You're slacking. And it's great. I loved it. It was good. It was all in good fun. But peri and postmenopausal women, types of training, this is really what we're looking at. We're trying to maintain not just good glucose, but bone and muscle. And we're looking at both strength and power and endurance. This focus is on this heavy resistance, which is fewer reps. Don't do 3 sets of 20 of anything, because that's just doing aerobics for your bicep. You're not going anabolic at all on that. You got to do multiple joints, and you want to do fewer reps with heavier weight. Obviously, you're going to be starting slow and low, so you don't give yourself a tendonitis the first night. and you're out of it for the next 6 months seeing us for PRP injections. No, we want you to do this with a trainer so that they are going to help you not hurt yourself. We're not 25 anymore. Some of you might be in here, actually, speaking for the bulk of us. So we're looking at lower reps. What does that mean? Usually it's around 5 to 8 reps is it. So anything more than 8 reps, you're probably lifting too little weight, no matter what it is that you're doing, whether it's curls, triceps, biceps, press, squats, deadlift, what have you. So it's, a lot of, Stacy refers to it as 5 by 5s, doing 5 sets of 5 reps. And if you do only 5 of anything, you realize, wow, I can do a whole lot more. And that's the idea. Why would we want to do that? Doesn't that cause more injury? It can if you don't have the right form and if you don't start low and slow and work up to it over weeks. You don't want to go out there and just go, power max lift 5 times. You're going to destroy your tendons or your back, your disc. The reason I want to do this is because it's sending a message to our neuromuscular system that you're serious about keeping your muscle and your bone. And when you do lighter weight than that, you get hecka strong muscles and nice sinewy looking muscles, but you're not getting that adaptation is the right word that's used in exercise physiology data. Adaptation, cellular adaptation is what we're after. And to do that, as Stacy says, you need to lift heavy stuff. So, and even you guys do, especially you guys do, not just, and I realize you're thinking about now, well, I don't want those big arms. I'm embarrassed. I don't want big muscles. I don't want you to have those unless you want them either. And you don't have to, but you can still get tone and get this adaptation effect without, being a bodybuilder. We're not trying to make bodybuilders out of you tonight. That's important that you don't leave here thinking that that's what I was trying to say. So plyometrics, we talked a little bit about, and then pelvic floor health becomes more important as we age. Those muscles and the sphincter muscles that control bladder continence, they change when those hormones go away and after we popped out a few little ninjas, don't they? So I'm speaking from a girl's perspective in a guy's body because for 35 years I've listened to you all about what happens. So I almost feel like I have some of that empathy. So yes, pelvic floor health and strengthening exercises are important, especially if you're already having some trouble when you laugh too hard, cough, sneeze, and you're like, oop, something just happened below. I just leaked. And that's super common. You're normal. There's things we can do to optimize that, not just with physical therapy, but also with hormones. And so don't be afraid. You talk to these gals that are just amazing, and so they're dealing with that too, and they don't let it stop them. They just take care of it. And of course, we're focusing on the endurance side. Again, not on the stair steppers. I'm a huge cycling fan. That's been my background is all cardio. We want to focus not just on how long and slow and steady, but what's the intensity of our cardio? So we're looking at strength and power for these reasons. And we're looking at HIIT and SIT. Remember those acronyms, high intensity intervals, sprint intensity intervals, because it's good for our heart, our brains, managing blood sugar, and managing body fat. And I don't think there's anyone that's walked through those back doors here since we opened that doesn't have an interest in those 4 things. So how do we do it? Well, here's how we don't do it. Low energy availability, LAE, it's actually got a term, and it's defined as how much energy you've got left from what you've taken in dietarily after you've done your workout for the day, your exercise, your physical activity. And for a lot of people that are fasting when they're exercising or under eating on protein, and yet they're out just killing it on some form of exercise, and they think that that's a faster way to lose weight, they're putting themselves into this LAE territory. Well, why is that a bad thing? Well, especially in women, it can be a bad thing because when we do that, you don't have a lot of psychological or physiological power left to do the other things you need to do during the day, like maybe everything else, right? So it's a problem, but it's also a problem because it shuts you down. Everybody knows about the gals that do too much CrossFit or marathon or ultras who stop having periods. That's just one example of LAE. You have less energy in from your dietary intake than you've expended, more than you had your deficit spending. And what happens is you start to downregulate your body systems. You actually start to lose lean muscle mass. You start to consume yourself. You start to basically break down and oxidize amino acids, which is protein, to try to find more energy because you're net negative. So eating less to lose weight makes no sense. More so, eating less to maintain bone and lean muscle makes no sense. And in fact, you'll become osteoporotic. You'll start to see people that are thin, that are really fit looking aerobically, who start losing bone and muscle. And they even can start developing prediabetes, even though they're not overweight. And I see that all day long here. And it's becoming more common. So you want to make sure that you're fueling appropriately. And if you're not, then you want to back down on your output. So your energy demand for training load needs to go down if you're not getting enough intake in from a dietary perspective. So you can see what's happening here when you've got the energy demand and having enough energy available to process, you're in a balanced position here in the middle. And that's based on intake. And so here's some of the things perimenopausally, menopausally that happen when you're not getting enough. And this is going to be the segue to the protein part of why y'all came. You start seeing endocrine dysfunction, and you start seeing less of a response to your working out. Why is nothing changing? Well, I'll often say there's toxic load maybe that we haven't looked at. You've got high cortisol, which is kind of kryptonite to anabolic everything, whether it's DHEA, whether it's testosterone, and that messes up your estrogen too. So cortisol and stress is a biggie, but it could also be that you've got LAE, as we call it. So you can see some metabolic dysfunction, decreased in endurance, feeling overtrained and chronically tired. What is wrong with me? I'm doing everything right, right? Bone health suffers. You get risk of stress fractures. Decreased functioning with the immunity. We see this right now. The Tour de France is going on over there. Those guys are so finely tuned, but there's such LAE during that 3 weeks of intense everyday activity. There's no way they can keep up dietarily with what they're expending. So they're existing in this state for months training, and then they go weeks over there. So they get sick really easily. They get colds really easily. Their immune system goes to pot. They get leaky gut. We can get leaky gut. We don't absorb our nutrients when we're underpowered. So this is the problem. You don't leave enough energy for everything else that your body needs to do when you either overload you with exercise or undereat, or both the right things. And yeah, you can have psychological impact for sure that occurs from that, because a lot of our neurotransmitters require amino acids, things like L-tryptophan and phenylalanine to make serotonin and dopamine. Let's talk about protein. So this is where stuff's getting real. So what about protein? Well, there's this estrogen-progesterone ratio that you got to consider. It's different during the cycle, and it's different when you're premenopausal, peri, and post, because you got different levels of estrogen and progesterone in all of those scenarios. So guess what? We have to account for that. We mentioned already that progesterone has a catabolic effect on muscle. You'll often see that there's this low carbohydrate availability in the second half of the cycle. We call it the luteal phase. That's after ovulation, when your body is waiting, thinking, is it going to happen? Nope, nothing's happening. Periods left, let everything go. That's going to be a low carbohydrate availability time. There's increased amino acids, proteins being broken down during exercise, and so this is a problem. Oral contraceptive formulations will mess with this protein requirement as well. As you move closer, luteal phase, you get this increased protein requirement. I think I mentioned earlier, it's about 12%. So all of you that have daughters that are athletes, tell them that when they're in that last half of their cycle, they need to up their protein by about 12%. Most people are too low on protein, which we're going to talk about where you need to be as a baseline. It changes based on how much activity and where you are in your cycle. And it changes depending on where you are as far as pre, peri, or postmenopausal. There's a term I want you to know. When your peri and postmenopausal women come talk to you about not being able to maintain lean muscle mass or losing bone, and they're doing everything they've done for the last 10 years and nothing's changed, well, it's not uncommon because, and you believe what they say, as they move into that age range, their bodies become less able and less sensitive to building lean muscle and bone. We call it anabolic resistance. So when you give them protein, you give them a weightlifting stimulus to make bone and muscle, they're less likely to do that. So their requirement goes up a little bit for both. And that's why you guys have to lift more heavy stuff over 50 than when you were 30. Yeah, because you don't have all that hormone and growth hormone there doing it for you. Now you got to find other signals. Higher protein, heavy stuff. Not the treadmill. Sorry. I love Peloton. Peloton's awesome. I love spin bike class, but it isn't going to do much for you in this kind of issue. So that kind of cardio is great. Work it into your program. Ride your bike on the green belt. For goodness sakes, have fun with your family, but you got to get a few days a week of this stuff in so that you're there for your grandkids and you're kicking ass when you're 75. There's no reason you shouldn't be. People are doing it. It is, don't accept anything less. Don't accept anything less. And I see it here every day. And these women are a freaking inspiration, let me tell you. So there's sex differences that become greater as far as protein requirements as we age between men and women. How fit you are determines your protein needs. There's recovery windows that are changed that are different between men and women, depending on the dosages of how much protein per meal is going to change based on your needs. In general, premenopausal women that are having regular periods that are athletic need about 1.6 to 2 grams per kilo per day. Okay. Now, this kilograms assumes that's an ideal body weight. Okay. So when you say I'm 250 pounds at 28 years of age, we're not going to say 1.6 times that many kilos. We have a adjustment that we make based on ideal body weight where you should be for that gender and height. And we make that adjustment from your ideal body weight. And that's the number we'll use, your kilograms, when we calculate protein need. Now, if somebody's already at their ideal body weight, and there's tables where you can figure that out based on height and gender, then you can take it at face value. You know, I'm 5'5", I'm 126 pounds, which I happen to know because I looked up before I walked out here. That's considered, for the most part, in a female ideal body weight for a 5'5" female. Now, if you're all muscular and you got a big frame and you're 140, don't sweat it. I love it. That's healthy. Don't worry about the weight. It's about composition, what you're made of, how much muscle, how much lean versus how much body fat. The weight, even the BMI is ridiculous. BMI doesn't take into account how much lean muscle mass you have. So I'd much rather work with somebody that is got a few extra pounds, who's got more lean muscle, than with someone who's what we call skinny fat, metabolically obese, and they're 50% body fat, but they're, 5'5" and they weigh 110. They've got a lot more of a difficult road to hoe because we gotta get that lean muscle mass up so that they can have metabolic success. And I see them, they're pre-diabetic and they're underweight, so they're metabolically dysfunctioning and yet they're not obese. So for peri and postmenopausal athletic, we're looking at really focusing on anabolic resistance, both in exercise and in protein amounts. Really the minimum for the peri and postmenopausal crowd at baseline is about 1.8 to 2 grams per kilo of ideal body weight. And, we're wanting to make sure that those are the right kinds of proteins. The types of proteins are made of amino acids that we're looking for are, it's not the stuff that's really inexpensive in a jar at the nutrition shop that's this big with big numbers. 32 grams of protein per scoop. You already know that's crap protein because they can't sell it for that if it's got the right stuff in it. We're looking for high amounts of three things: leucine, isoleucine, and valine. Those are your branched chain amino acids. Leucine leads the charge of all protein amino acids that's stimulating lean muscle. That's why the bodybuilders like whey. Whey is a natural isolate that's high in branched chain amino acid. For those of us that can't do dairy or whey, there's plant-based proteins that get you high quality ratios of branched chain aminos, leucine, isoleucine, and valine, as well as the other essential amino acids. There's 9 of those, and there's 3 of the branched chains. So do collagen peptides from Costco and Vital, all this stuff that you guys are on for your gut, is it helpful? Yeah, it's great. Those are things that are high in things like proline, methionine, things that you need for healing your gut and having health. However, it's the branched chain amino acid content that we want. And so I don't recommend collagen when I'm just trying to build lean muscle mass. I'm going to recommend something that's got the right amount of branched chain amino acids and the right amount of essential amino acids in there. So these are rough guidelines. They're based on ideal body weight. We do a little calculation to get the adjusted weight if someone's a bit overweight so that we don't give them too much protein. But I mean, right now, the current RDA for you all is, what is it, 0.8? 0.8 grams per kilo, which ends up giving you about a third, maybe a half of what you actually need. Those recommendations are based on what it takes to prevent you having protein malnutrition, like preventing scurvy with the vitamin C recommendations. It's crazy. It has nothing to do with maintaining bone and lean muscle. And we know that because we've got an epidemic of losing both in this country right now. So is too much protein hard on my kidney? Yes, it can be if you're really crazy excessive. So you got to work with somebody that understands your hydration, your glucose, your insulin, your metabolism, your hormones, and where you're at with protein needs. These are general guidelines for active people. Training is different from performance, and that's what she's talking about there. This is in athletes. We talked a little bit about protein. Let's talk a little bit about carbs. Bottom line, it's easier for guys to carb load, which the purpose of that is to really pump up the amount of stored glycogen, glucose in your muscles and in your liver, so that when you're doing some kind of an event, you can be at it longer. Women, it's a little harder for you guys to load carbohydrates. You can do it. What's interesting is that estrogen is promoting burning fat over carbs. Estrogen preserves carbohydrates in your liver and in your skeletal muscle. Okay. Whereas you'll see a little bit different effect with things like progesterone. So you guys have some unique things to guys. A lot of these things are not what's going on in guys' body at all. These are some of the requirements for carbohydrates based on light through very high intensity exercise. And it's really determined by the number of hours per day and how much intensity there is. For the average person here in the room that cares about their health, going after an hour a day, you guys are moderate exercisers, and your daily carb intake is somewhere between 5 to 7 grams per kilogram a day. And you do the math on that. If you're a 60 kilogram female, which is pretty average, and you multiply that times 5 to 7 grams, that's not a very low carb diet where you're doing 25 or 50 or 75 grams of carbohydrate a day. That's not going to work for keto. Okay. Athletes and keto should not be in the same sentence, period. Athletes in intermittent fasting, especially in women, should not be, in my opinion, in the same sentence. Fasted exercising, I'm not a believer. Sorry, I know there's a lot of people out there that are going to disagree with that. That's okay. I'm a believer in looking at what's going on metabolically for the brain, the cardiovascular system, and glucose signaling. And with the kind of needs that you guys have and the way your unique physiology works, you've got a fuel for exercise. You know, you want to get some carbs in pre, you want to get some protein in post exercise. And we're going to talk a little bit about creatine, which is a good thing for women. Creatine is a good thing for women. It does a lot of great stuff. What it doesn't do that it does in men is it doesn't prevent the breakdown of protein after you exercise. In guys, we get that added benefit, not sure why, but it doesn't happen in women. But you get a whole lot of other great stuff. As far as carbohydrates, this is kind of a good thing just as a baseline for athletic, active women to have, you know, so it gives you, you know, eating those starchy and non-starchy things. I'm not worried about it if you're that active. That's not going to cause weight gain. It's not going to drive your LDL sugar up, your cholesterol and sugars up per se. It's inactivity that worries me because then we've really limited our options as to successful metabolic health. So there's no shortcut. Sorry. I wish there was. I wish we didn't have to do stuff like this. And, you know, but our bodies were built to be stressed. Our bodies were built to take a little bit of discomfort. And we've made it so easy on them that now they're starting to fail. And so if there's ways to intelligibly incorporate these things into our diet and fueling correctly, that's really what we want to do.